Welcome to Module 2 of our course on Mastering Medical Decision-Making for E and M Coding. In this module, we will take a deep dive into the three essential components of MDM: the number and complexity of problems addressed, the amount and complexity of data reviewed, and the level of risk involved. By the end of this module, you'll be able to accurately assess and document these components to determine the correct E and M code for patient encounters. In this module, we'll break down the three components of MDM. First, we'll explore how to categorize patient problems based on complexity. Then we'll discuss how to document the data reviewed and analyzed. Finally, we'll look at how risk is determined based on medical decision-making. We'll also introduce the 2 out of 3 rule, which is essential for determining the correct MDM level. MDM is built on 3 core components. First, we assess the number and complexity of problems addressed during the visit. Second, we determine how much data was reviewed or analyzed, including test results and consultations. Third, we evaluate the level of risk associated with treatment decisions, and these 3 elements work together to determine the appropriate E and M code for an encounter. The first component of MDM involves determining the complexity of the problems addressed during a visit. If the patient has a self-limited or minor problem, such as a common cold, this is considered straightforward. A patient with a stable chronic illness or an acute, uncomplicated condition like a urinary tract infection falls into the low complexity category. Moderate complexity includes cases where there are multiple stable conditions, an undiagnosed new problem with an uncertain prognosis, or an acute illness with systemic symptoms such as pneumonia. High complexity applies when a patient has a chronic illness with severe exacerbation, such as worsening heart failure or a condition that poses a direct threat to life or bodily function. Let's look at some real-world examples. A common cold, minor rash, or bug bite falls under straightforward complexity. Low complexity includes stable chronic conditions like mild asthma or well-controlled diabetes. Moderate complexity could be a new lump in the breast, pneumonia, or worsening COPD. High complexity includes life-threatening conditions such as septic shock, an acute stroke, or a severe asthma attack that requires emergency intervention. The second component of MDM involves the amount and complexity of data reviewed. This includes reviewing lab, imaging, or pathology results, ordering and interpreting tests, and obtaining additional patient history from a third party. It also includes discussions with other physicians regarding patient management and independent interpretation of diagnostic tests. Data complexity ranges from minimal, where no tests are ordered, to high complexity, where multiple test results are reviewed, independent interpretations are performed, and discussions with specialists are required. Moderate complexity is met when 2 or more types of data are reviewed or analyzed. The third component of MDM is risk assessment. Risk is determined by the complexity of the diagnosis and treatment, medication management decisions, and surgical or procedural risks. Social determinants of health, such as a patient's inability to afford medication, can also contribute to the overall risk assessment. Minimal risk includes treatments such as recommending rest or fluids. Low risk applies to over-the-counter medications and minor procedures. Moderate risk includes prescription drug management and minor surgery with risk factors. High risk applies to major surgery, intensive drug monitoring, and critical decisions such as a do not resuscitate order. To assign an MDM level, at least 2 of the 3 components must meet or exceed a specific complexity level. For example, if a patient has 2 stable chronic illnesses and is on prescription medication, that encounter qualifies as moderate complexity.